Blood pressure raises your risk of dementia, but a new study says vigorous exercise could help in avoiding any cognitive impairment. Joining us now to talk about this and other health topics today is Dr. Jeff Pothof, UW Health Chief Quality Officer. So let's talk about this one, Dr. Pothof. I assume that all of us want to ward off any sort of precursor putting us at risk of developing memory issues. This is just another reason to exercise, right?
Yeah, as if we needed another reason. But this study looked at people age 50 and older, about 9,300 of them. And it looked at data from a previous trial, and it looked at people who self-reported vigorous exercise at least one time per week. And then when you compare their scores on tests that kind of look at cognitive decline, these are people with high blood pressure, they did much better than those who didn't have vigorous exercise. It's an interesting study in that about 62% of these participants up to age 75 reported at least vigorous exercise once a week, defining vigorous exercise by exercise that would make it unable for you to, speak a full sentence. So there's some question about whether these folks self-reported correctly, but certainly the association between exercise, the benefits for high blood pressure and reducing risk for dementia are pretty well established. This would be a good thing to do if you want to ward off dementia later in life.
Just exercise, just get off the couch and just do it. I mean, don't leave while you're watching Fox 6, but you can always walk on the treadmill at the gym and watch us. So
there you go.
We've had a lot of talk recently, and we've even talked about it, about the bird flu infecting cows and then spreading to a couple of humans. So far, the cases in humans haven't really been anything significant until now. There's been a death reported.
There has been, although, not to spoil the fun, I still think we don't have a lot to worry about with bird flu. So this is actually a bit of a different strain. In the U.S., we've been talking about H5N1 that's been found in cattle. We've had a couple of cases, not many. This is H5N2 in Mexico. But the case that they're talking about, we don't have all the details, but it sounds like this is an individual who had underlying medical conditions, wasn't at pinnacle of health and did pass away from this bird flu. I think the take home for bird flu is still the same. We need to keep a close eye on it. We don't want to see more cases of bird flu infecting humans. That doesn't happen very often right now. If that were to happen more often, that might suggest that this virus has mutated and is going to be a bigger problem for humans. But currently, the big problem is for poultry, and we just need to keep an eye on it.
Keep an eye on it. All right. And the cows out there. Let's talk male birth control. Not the first time male birth control has ever been in the headlines, but there is a new product that seems to be proving successful. It's not a drug you take, but rather a gel that men rub on their shoulders. Explain this one.
Yeah, it's super interesting, right? Yeah, researchers have been working on this for close to 20 years. And the way you do male birth control, or what the researchers did, is you want to reduce the sperm counts. You can do that by having hormones go into the body that can reduce sperm counts to, 1 million or less, which is nowhere near what it takes to get someone pregnant. They've tried this with like injections, like the things that you would kind of assume they would try, and it didn't work. Either side effects were too bad or they didn't get the hormone levels that they want. But what they're finding, if you put a gel on your shoulder, your skin, every day for a good period of time, a couple of months, they can drop those testosterone levels low enough that you are not able to get someone pregnant. At the same time, you have enough testosterone where you don't have a lot of the adverse side effects of having too little testosterone, and it's about 86% effective in this trial. So not ready for prime time yet. Seems like an awful lot of work, but finally something out there to potentially have men do their part to participate in this birth control discussion. I'm
just going to ask the one question that everybody at home is asking, and we have about 10 seconds. Why the shoulders?
Why the shoulders? So it creates a depot of this medication that then is absorbed slowly but constantly. If you give it as an injection, too big of a dose. If you give it as a pill, goes away too quickly. So gel on the skin that creates hormones that get diffused over time.
Fascinating. All right, Dr. Pothof, great conversation today. Thanks.
Thanks, you bet.